Uh, Welcome, everybody, to our final CCI webinar, our Wharton CCI webinar, Working with Community, the Good, the Bad, and the Unexpected. I'd like to start by acknowledging the Aboriginal and Torres Strait Islander people as the custodians of the land on which we live, learn, and work, and we pay our respects to elders past, present, and emerging. And we especially take this time to recognise and honour Indigenous women who are with us and also who have come before us. And we look to their collective wisdom in guiding our work and seek continued partnership as we work together to improve health outcomes for all women living in this land. Welcome, everybody. So I'm going to introduce myself. My name is Leslie Arnott. I'm the Consumer Partnerships Lead and a steering committee member and a member of the CCI subcommittee for the Women's Health Research Translation and Impact Network, more affectionately known as WHRTN. And I have two fantastic co-presenters with me today, and I'm going to let them introduce themselves. So Ashley, I'll hand it over to you.
Thanks, Liz. So my name is Ashley. I'm a research fellow at Monash Uni at Macquarie, where Leslie is based as well. And I'm also a diabetes advocate. So I like to think I combine both of those hats pretty well and just facilitate lived experience involvement in research, which is sort of how I sort of got into this project as well. So it's been a huge honor, privilege, and a huge learning curve as well. So I'll hand it over to Tammy to introduce herself.
Hi, I'm Tammy Milne. I'm a consumer advocate for Wharton, a CCI member, and a research assistant. I think I'm a research assistant on this project or a consumer advocate, one or the other. Yeah, and it's great to be here. Thank you.
And Tammy, do you want to share your background a little bit?
Sure. So I live on the heart-shaped island at the end of Australia. And I'm a disability advocate, have been for many years. I live with a disability, and I'm here and involved in this project because engaging priority populations is key to any sort of research. When we look at research, we need to get everybody in our population. And as we've found in this project, it's been tricky, but it is the most valuable and the most rewarding to get it right.
That's great. Thank you so much, Tammy. That's lovely. So I'll start by giving a little bit of a background to this project. It started off with a conversation with Deb Langridge, who's part of the Western Australia Health Translation Network. She's the consumer lead for their CCI program. And we were talking about different ways in which we can engage women from priority populations. And of course, Deb comes from a public services background, so to speak, in and around local council. And there was a project that they had been working on. A local council went to the university over there and wanted the university to help out with a health issue program, a health issue whereby the researchers researched how the people in the town themselves could actually do something about this major health issue, and indeed it worked. And so I thought to myself, maybe we should flip it, and rather than the community come to us, we go to the community to find out how we can engage with women from priority populations. And indeed, this is how this project was born. So the problem that we have is that NHMRC and the MRFF expectations are that, researchers must demonstrate meaningful CCI in their projects, but that challenge for researchers is not only lack of implementation tools and resources, but time. It's really difficult for researchers to do this. It's difficult to connect to and build relationships with women from priority populations if they don't have the time to do it. So we had an opportunity here to work out how to do that. And that's indeed what we did. We created a co-designed outward-facing project, and we engaged with councils and health peak bodies and consumer-led groups to find out how the best way is to engage with women from priority populations. So the aims of our project were to identify and map the key stakeholders involved engaging with women from priority populations, explore the strategies to engage with women, how they actually engage with women or how they don't. Also, that's something to be explored as well. To co-produce the resources for capacity building for our researchers and our clinicians that work on research projects with priority populations, and to build meaningful and sustainable relationships with stakeholders. So we set up a governance group for this project. We had an advisory group. The advisory group was actually made up of our CCI subcommittee, which included researchers and consumers, but we also invited the other consumers from our other subcommittees as well. We had a project manager who was Amy Armstrong, and myself as the consumer partnerships lead. We had Ashley as the researcher, and we had consumer liaisons, one of whom is Tammy, who has joined us today. And so our external stakeholders were councils, health peak bodies, consumer-led organizations, and primary healthcare networks. We also sought some advice from the CCI subcommittee, but also some people within MICRE, and also people from Monash Partners as well. And that was really helpful. So Ashley, I'll hand it over to you.
Thanks, Leslie. So my role was really to bring in the robustness in the research side of things. So it's great that we have this amazing project. And so now how do we conduct it so that it is robust and it's got that research methodology behind it? So we decided to apply the CIFRA framework, so the Consolidated Framework for Implementation Research, really just focusing on those three broad levels in terms of the outer setting, which is the broader system, policy level, the inner settings, which are the organizations that work within that, and so the individuals in terms of the women from priority populations and the researchers and the individuals that work at those organizations. And so within that ecosystem, thinking about how women from priority populations can be supported in supporting research, in supporting future work as well, and how to best partner with them. So throughout the whole journey, we've had this in the back of our mind, and you'll see it pop up a couple of times in this presentation around how we framed our outputs, how we framed our analysis, and what's coming up next as well.
Right. So we recruited nationally through our partnerships within the Wharton Centres, which exist in the ARA Alliance, and diversity was absolutely key on a number of levels. So diversity in the women that we recruited, by prioritizing priority populations. That's hard to say. In line with our 9 health priorities, diversity in the geographics with rural and urban regions represented, and diversity in the associated ARA centers. So we had one that was a mature center, and we had another center that was an emerging one. And then we provided training to our consumer liaisons, beginning with completing a project logic. And I'm going to bring Tammy in now, but just before I bring Tammy in, I just wanted to say that right from the very beginning, this project has been co-designed. Not only my role here within Wharton and indeed in MICRE is an embedded consumer expert. But right from the very beginning, not only was my voice in this, but other consumers' voices were in it right from the very beginning. And I just wanted to make that point because I think it's really important. So I'm going to bring Tammy in now, who was one of our consumer liaisons who you've just met. And I'd like to get some reflections on about the project logic that we presented and worked with the consumer liaisons. Tammy, what was your overall thought about doing the project logic? I find them useful, but others may not.
I guess for me, it basically embedded the understanding of the project firmly in my brain. So we wordsmithed the project logic, sort of reinforcing at every stage with every word what we were actually doing. So it was teaching us and reinforcing the project that we were undertaking.
Yeah, I found it like that too, and it was really fun to wordsmith it, wasn't it? It was terrific. Everybody had a hand in it, which was brilliant. So after the project logic, we provided support and training. And then in collaboration with Ashley, we co-created the questions that we would ask councils and the associated organizations. So do you have any more reflections, Tammy, to add to what it was like in the training and the support that's been provided?
Yeah, the training was great. Just the idea of the different levels of interactions we are having with different organisations and how the questions that we formulated were specific to those organisations. So we had like that slightly different but same. So the questions followed the same path, but maybe the words were a little different just for the different cohorts. And that also embedded the understanding of what we were doing, how we were going to do it, the whole, the mechanics of it, I guess, the nuts and bolts of the project so that we knew exactly what we're up against.
Thank you. Thank you so much. That's brilliant. Thanks so much, Tammy. Ashley, I'm going to bring you in for this next slide.
So initially, after we planned out the different interview guides, we had this beautiful plan of how we were going to approach it. It was going to be a very systematic and logical approach in terms of we would start off looking at the councils, and then from the councils, we read through the health and wellbeing plan, identify priorities in terms of health priorities that align with WHRTN, and then from there, look at the primary health network as well as the consumer led organizations and the health peak bodies. And then from each of those organizations, we would then go out, interview them, and then ask for snowball recommendations to community members, so women from priority populations that they are linked in with as well. So the idea is that we wanted to get perspectives from a regional and rural area, but also from a metropolitan area as well. And just to see how the interactions and the relationships work between the organizations as well as women from priority populations too. So in our minds, this was like the beautiful, perfect sequence of events that were to happen. And then I'll throw it over to Les to talk about more about the interview process because that was quite a learning as well.
It was, that's for sure. So, in setting up the interviews, we co designed the process of finding appropriate people to interview, actually. Ashley helped guide the questionnaire development based on the CFR framework, and together we co designed the questionnaires, the scripts, the templates, the process of engaging organizations and correspondence, the emails, all of which help to create the resource for researchers on how to engage with women from priority populations. Tammy, in terms of any reflections you have there, were there any challenges at all? Did you want to share anything about that process?
Yeah, sure, Les. I think everybody is time poor, and we, you know, bright-eyed and bucky-tailed or whatever it's called, went out thinking this is going to be so good. But the problems that we came up against were we think it's really good. But then the people we're trying to engage to interview are thinking, yeah, it's really good too, but I don't have time for it. And so that was a struggle to actually convince people that this was worthwhile and offer them something back at the end of it. So the process was that we were offering them our research in sort of payment for their time so they could learn from what we had set up. Yeah.
Yeah, absolutely. And one of the things that we did decide, we actually were going to use recorders at the very beginning, and then it turned out whereby it worked out better. And Ashley really assisted with this, where Ashley would set up all of the interviews, which meant that the interviews were automatically recorded, so we didn't have to think about using the recorders and that type of thing. Um, Yeah, Ashley, did you want to add anything more to that?
Um, I think throughout our learnings, it was about streamlining the process that we worked through on, but also what would be the least path of resistance that our consumer liaisons can just focus on doing what they do best in terms of
Yeah.
tapping into the networks and talking to people and getting those learnings from them. So I think we played around with a couple of different things, and it is a bit of a trial and error. And so I think with lots of different types of projects, it's about there's no one size fits all. It's testing out what works for the current
Yeah.
group that you've got as well. And so it's a
Yeah.
really great question that's just come through, Les, around reflecting on your co-design journey. What would you do differently next time?
Mm-hmm.
Um, I think thinking back from a researcher perspective, I don't know if there's anything I would do differently because I think every step of the way we've learned something and we've sort of tailored things along the way. Maybe perhaps allowing more time in the project, which may or may not be realistic for some projects as well. There's quite tight deadlines. When you talk about co-design, it does take a bit more time because you do
Yeah.
come up with different challenges and different troubleshooting things as well in order to make it truly co-design. So I think that's the only
Mm-hmm.
thing I would um, do differently, sort of factor in that extra time and buffer time as well. I don't know
Right.
about you guys, Tammy and Les, and I know Juliana's also there too. So yeah,
Mm. Yeah, that's a good point. Okay, keep going, Ashley.
I'll keep going. Okay. So I guess what we ended up doing in terms of actual interviews, we did go out to councils, we did go out to the PHNs, the primary health networks, not public health networks, and I keep getting mixed up. Health peak bodies as well as consumer-led organizations, and we had some really good responses there and really, really rich learnings from all of them, as well as the women from priority populations. As we went through that, we did come up with some challenges, and it was really, really based on, and this is one of our key findings, based on the relationships that currently existed with our consumer liaisons as well. So without those, it would have been probably a lot harder to get in terms of finding the right person to speak to and getting the right people to sort of walk pass us along as well. So we
Mm.
then also expanded to say we needed more high level key opinion leaders to support our work in terms of getting that level of information. So we've included national stakeholders as well as key lived experience leaders as well who are women in the priority populations area.
Yeah. I moved that slide on to because you're actually talking to that very point, Ashley,
Oh,
which
okay.
was it was a really good point to make, which the consumer liaisons connections into communities was an absolute plus. And this
Mm,
actually uh, goes to the heart of why it's so important to build relationships. Some people that we may not have been able to interview, we were able to do that because they had established relationships into the community. And this is another reason why it's great to actually embrace and involve our consumer advocates in our work because they may very well have the connections that we don't.
yep.
And that's a really great point. So some of our aha moments um, was that the streamlining was better. You spoke about that earlier with doing the recordings online, that type of thing, and making it and supporting our consumer liaisons to do the work more easily. That computer literacy is a consideration, and that adequate technology that people have access to is in place. That's just to flag it. It's not to say that you wouldn't actually use somebody if they didn't have that in place. It was just to make sure that you had some support around it. And also, one of the aha things that I tended to find was that national, culturally, and linguistically diverse and Indigenous organizations that besides the fact that they work at policy influence level, they were still directly connected into their communities. They were extraordinary. So culturally and linguistically diverse and Indigenous organizations are those to speak with and learn from. We can take a page out of their book for learning how to be connected right from the grassroots right up to policy and decision making. It's quite extraordinary. Tammy, did you want to make any comment to that anymore?
And Liz,
I
I also
guess
wanted
you
to,
can
oh, sorry.
use the saying, nothing about us without us, and apply it to all priority population people that belong to the priority populations. There's an understanding academically about, preconceived ideas of a population, but then the reality of life and lifestyle and culture comes from actually embedding yourself in a community and getting to know the community.
Absolutely, good point. Ashley, you were going to say something there.
I was,
Oh,
and I
I thought I heard
forgot.
you were going to say
I
something.
was, and I forgot what it was. It will come back.
That's all right. It'll come back. Don't worry.
It will come back.
Okay, so I'll hand it over to you. Here you go. You'll be able to still speak.
Okay. Oh, this is going so well. And so I think so once we've got all that data there, it was so great to hear the rich stories that were coming through. It was a lot of learning in terms of, I think, the processes of I think stepping consumer liaisons through the processes of what happens to ensure that we have everything stored correctly, that we have everything transcribed correctly, and then the analysis process as well. So with the analysis process, we did a framework analysis because we wanted to really develop those resources according to those different sectors. And so this was really done primarily by Leslie and myself, where we went back and forth to agree on certain themes, where they sat in terms of the different sectors of the framework. And so it was very much an iterative process. So what we would do is I would go through every single transcript and sort of come up with those themes. And Leslie and I would talk about that because she was very immersed in that data as well. Once we've done that, we then also took those results back out to the consumer liaisons and the steering committee, say, does this make sense to you? Is there anything that we're missing? And it was also through that process where we did find out, oh, we should really be talking to a few more people with the national stakeholders, with the key lived experience women as well. And so it was through there that we added those extra data points in there and then went through that process back and forth again.
Yeah.
So really, here we summarized the 5 key themes that we've come out from all the different interviews. And I think resonating with every single interview that we've had is the importance of relationships and how they are the heart of connection and not just one directional. It does work both ways. So it's not just, the researchers or the organizations reaching out to and from priority populations from time to time, but it's also a need from the other side as well. So I guess looking at that basic, what can I do for you and what can you do for me? It's not transactional and not making it transactional, but making and showing up where at events where it really matters to each different organization and community group as well. So some of the stories we heard were, it was so great that the organizations came and supported our community event. They didn't have to be there, but they showed up and that was what mattered. So having that heart-to-heart personal relationship is really important there. And then the second one around the stories that we've heard around navigating healthcare system land so heavily on women from priority populations and who are usually the least resourced to actually try and navigate those waters, those murky waters. For me, as a very educated woman, trying to navigate the healthcare system is hard enough. And I, hearing the stories of how all the additional challenges that some of these women have had to jump over hoops to actually go and advocate for themselves and be heard and actually be recognized and acknowledged. It is heartbreaking at times, but just the resolve and the resilience that they showed is amazing as well. And then so I guess then leads in really nicely to the next theme that we had, and this was a direct quote from one of the participants, was don't ask me what's wrong with this group, ask what's working and what the enablers are. So really focusing on that strength-based approaches. And I think sometimes we get really caught up on what's not working, what can we fix? Whereas sometimes if we flip that and said, okay, what's working really well and what can we have more of that is working well that can then accommodate for things that aren't working well, for example. And so when we as researchers go out to community groups, we're often saying like, what's wrong? What can we fix? We come with a very negative tone. And so that's a very poor first impressions in that sense. So I think it's really important to then flip that script a little bit. Psychological safety and cultural safety is really important. And this really sets up the expectations of what is expected when we go out into these community groups. And I say we go out into the community groups physically as well. We don't just wait for them to come to us. As from a researcher and organization perspective, it's really important that we take that first step and go out to them, and understand what to expect, how to behave, what are some of the cultural norms, and return, we share that with community groups and women from prior populations in terms of what to expect when you're working with researchers as well, just as we have in this process when we're working with Tammy and our consumer liaisons in terms of, here's what to expect. The analysis and the transcription process will take a long time, and the development of the resources will take a long time, and the write-up as well, and here's what to expect. And so being very guided in those processes is really key, so that everyone is clear as to what's happening now, who's accountable, what the next steps are, and when to expect that. Which then also ties in really nice to the last point around accountability. And we often hear this through the need to close the loop in communications, because how many times have we taken part in different surveys for different things and never heard back from those who are actually doing that work? We don't know what the results are. We don't know how the results have been used. And so we have been very cognizant in doing that within our capacity in terms of reaching out to organizations, thanking them. And so you'll see in the outputs that we're developing that we are also aiming to do this as well.
Actually, that reminds me that I'd like to do that again, to even before we finish with providing the resources, just to say, hey, we're still working on them and we'll get there. So it's kind of nice to keep everybody in the loop, isn't it? Yeah. So Ashley, I'll get you to speak to those first 3 points.
Sure. So originally, when we were looking at, okay, what are some of the outputs we want to do and to produce from this piece of work, rather than just one publication, we wanted to have something that we could give back to the community as well. So initially, we wanted to have a report to the organization so that the organizations know what others are doing in this space, because often people work in silos and it's very difficult for people to come together, in terms of limited resourcing, to then learn, oh, there's this really good initiative here and there's something else that's there that we can just learn and adapt, rather than reinventing the wheel. So we see this a lot in healthcare. We see this a lot in different areas. So with this report to organizations, it would just be summarizing the key things that we have learned from that high level perspective, and sharing some of the things that have worked well, some of the challenges that people have reported, and maybe some recommendations of how to strengthen that down the track as well. We spoke about having a resource that's specific to researchers who are looking to partner with women from priority populations for their work, and how to best do that, because we want them to go in with an understanding of, being culturally appropriate, but also different avenues of doing so. And I've just remembered my point from before, is that there is no wrong door in terms of connecting with the community. So even though, and that's where we fell a little bit flat with our initial plan of going through the councils, is that there are different community groups connect to people in different ways, whether it be through organizations, through community members, through larger organizations as well. There is no wrong door in terms of connecting with women from priority populations. It's just finding the right relationships and finding the right people. That's really key. So that was going to be our key summary of resources that we were going to produce. And yeah, we also toyed around with different mediums as well. So having a video, for example, and having written resources and having a publication. So we're targeting different health literacy levels. So that's the initial plan. And it kind of just fell apart when we kind of shared it with the broader steering group. We realized that there were a couple of things that we had missed out as well. So I'll let Les talk to that part.
Yeah, the other thing too is that we actually went back to our EMCR's networks and asked them what type of resource would be really useful for you to help you engage with women from priority populations. And what came back overwhelmingly was the idea of checklists. That was the preferred resource, not something that's 48 pages long, but perhaps one or two. And then may have some descriptors and or supporting literature with it. But that was the major one. Um, we also went back to there was something that was niggling at me a little bit. I just needed to hear some really beautiful, seasoned, wisdom-filled voices in this space, and so I went back to four of our highly seasoned consumer advocates, our lived experience leaders, one of whom was Tammy. And we went back and we asked some questions there. Kathy Liane she heads up an Indigenous mothers and children's program. She's not a researcher or a clinician. She's embedded in the Women's and Children's Network in Adelaide. Iman Aldasuki, who works with the Multicultural Center for Women's Health. She's also worked in Women in the North, a fierce advocate for providing capacity building around learning the health system for women, for new migrants. She's originally from Jordan. Then there's Tammy, who you've already met, and Malavika, who also has worked in Women from the North. She's also worked in a council. She's also working with women in the Southeast now, and is highly connected into various communities. Amazingly, her networks are quite extensive. So these people have rich, wonderful experiences linking in with women from priority populations. So we asked a series of 4 questions. And I did ask, and Tammy, I'm going to bring you back in here because there was a question, one of the 4 questions that we asked that I thought you had some lovely answers to, and that was about what were what 3 key points could you speak about that you would like researchers to know when working with women from priority populations? Can you remember what you said?
Yeah, so the first one is to go into any relationship with a trauma-informed background. So understand the cohort that you're going to research, and really do some research yourself and don't go in blindly. I
Mm-hmm.
guess the second one is network and find relationships, because the right people can introduce you to the right people. And it just means that, so I think I said this before, that when doing research, it's easy to pick the low hanging fruit, but what we really need is to drill down and get the people that really give depth and richness to research because they live the lives of from perspective of a priority population. So
Yeah,
that's the sort of group that we really strongly need
yeah.
to find. Yeah. And the third one was don't go in with a preconceived agenda. So it's research. Go in with an open mind and, find the data, find the stories, find the richness of what this discovery can lead you to. Yeah.
Hmm. I think that your number 2 speaks of what I was trying to say earlier, but I got my tongue tied around it, which was prioritize priority populations. We've gone from saying things like underserved or underrepresented, and I much prefer using the term priority populations because it's a more positive term for a start. But it's actually something that we should do. It's not something that we should just say. It's something that we should do. We have to prioritize them. We need to put the thought of priority populations in front of everything that we are thinking, and you go from there. So your number 2 spoke beautifully to that, I have to say. So our aha moments or our unexpected moments. So um, resources were not just for researchers. We needed to give back to the organizations that gave our time and provided rich data, and that includes to consumer organizations as well. When recruiting for projects, we have to start with diversity first. It's harder. I know it's harder, but it's richer. And we use that phrase priority populations for a reason. We must prioritize and we need to honor that. So you start with diversity first. We also considered that we could give back to consumers. We've never done this before. We've never actually created a tool that consumers could use, that they would be able to use for organizations and or researchers to have a set of questions that actually says, well, how am I going to get paid? And what will this do for me? And what do you want me to bring to the table? And why are you asking me? And those types of things. So we co-designed a set of questions, a questionnaire for consumers to go the other way. And I don't think anybody's ever done that before. Or if they have, they haven't done it for women from priority populations. So that was kind of a nice thing. And that's part of the reason why when it was niggling at me before that we were missing something. And as soon as I interviewed Tammy and Malavika and Iman and Kathy, that fast fire feedback from those wisdom filled individuals provided the data to help us co-design that consumer resource. So I'll hand it over to you, Ashley.
Thanks. So going back to our lovely CIFA framework, so when we had those three main, I guess, levels within our ecosystem, so thinking back to our outer setting, so how do we give back to those like policy level, organizational level, national organizational level stakeholders, and that would be, I guess, reaching through broad sources, so things like doing a presentation like this, but also our peer-reviewed publication that will be published as well, so through the scientific journals, and that will help distribute that piece of work broadly to the scientific and academic community, and really contribute to that evidence-based background as well. In terms of the inner setting, so we're looking at the different organizations that were involved, so like the councils, the PHNs as well. So having that report for the organization, so we're still going to be going ahead with that, and making sure that that's in a very easy, summarized report that can be read quickly as well. So not like, a 100-page type report thing. No one wants to read that, but very practical takeaways at the very end as well. So what are some recommendations that they can then adopt, or that other organizations have adopted to better network and connect with women from priority populations to strengthen their offerings and services there. And then at the individual level, so looking at for researchers as well as for women from priority populations, for researchers looking at what are some of the key considerations and a bit of a guide to develop that pathway to working with women from priority population, knowing that there is no wrong door to go in from, and there are multiple avenues of how to start. I think this is where researchers freeze a little bit in terms of this is not what we are normally trained to do. So where do we begin, and how do we actually get this started? So that's going to be a bit of a guide there for researchers. And then for women from priority populations, it's going to be a bit of a checklist or a question prompt list even, because you really don't know what you don't know. And so having a guide in terms of what questions to ask researchers and organizations before they get involved will be really helpful and useful, to empower them to then, be in control of how they choose to use their time and their volunteer time particularly, and making sure that the work that they are involved with is genuine and meaningful rather than a tokenistic one. So they'll have questions like, what's your terms of reference like? How are you reimbursing people? What's the time frame for that? How are you going to communicate with us? How often am I expected to be involved in meetings and things like that? So just some of the things to sort of float that back to researchers and organizations, which then also holds them accountable to ensuring that they have these systems and check points in place as well. So it's a bit of an accountability setting there, which is great, because otherwise organizations can just say, well, yes, we've co-designed this and this is how we've done it. But without that accountability setting, no one's actually ensuring that these are meaningful works that take place. So that's what we're currently working on.
And it's great, Ashley. I'm really pleased to do this work with you too, because it also honors one of our principles that we go by, our co-productive principles, which is reciprocity. And when we get that information to help our researchers, we need to really be able to give back not only to the organizations but also to those consumers who gave their wisdom. We need to be able to come up with something that we can give them back, and hopefully that will be something that they can use as they move forward and work with organizations and or researchers in the future. So I'm really pleased that we were able to come up with that idea. Tammy, would you like to talk about this one?
So I guess, all the really hard work of setting up interviews, interviewing people, the stress of is balanced with relationships. And so we built a team around this research project. And this is, I guess, exemplifies the joy that we had working with each other. It was our sort of Christmas party, I guess, that we had on Zoom. We were still working, but of course, we made the most of it and had some fun as well. And it just, we were that positive interaction with each other, build our confidence and trust in each other. And it was just a joy to work with everyone.
Back at you, Tammy. That's fantastic. So now I'm actually going to throw it out to the floor a little bit. And Amy or Ashley, I'm not quite sure if there were any questions that some of our attendees would like to ask us today about this process. Rest
We had
assured.
one
Yep.
question that I kind of wanted to revisit around, like, if you were to do this whole process again, what would you do differently? So you've heard from me. I'd love to hear, like, Leslie, what would you do differently? And Tammy, what would you do differently as well? Apart from not stressing Amy out so much.
Um, I think you touched on time. There's not as much time that was allotted to my role as much as I'd like it to have been. So that means that we could have, produced some things a little bit quicker. That was one thing. Um, I would like to have made it bigger, believe it or not, to involve some other jurisdictions and some other rural areas. Having said that, though, we made sure, as I said in the beginning, that we had diversity in geographics with the councils that we linked in with. Um, I'm going to acquiesce. Let me think about that a little bit more. And Tammy, I'll hand it over to you for a second. If I think of anything else, I'll let you know.
I think the whole process was a learning process for me anyway. And so building on my prior knowledge, um, it wasn't this the speed thing was like, oh my God, it's so slow, that sort of thing. When you're at uni, you've got 13 weeks to take in the content, and then you have to put out like a coherent, referenced, academic paper at the end. This has not been a 13-week adventure. It's been a long-term adventure. And so again, looking at the time frame and, just saying to myself, settle down, um, you know, cooler heads than mine are in charge. It's okay. Um, I guess, or from my perspective from the interviews, I would have taken a lot more of my prior knowledge on culturally sensitive issues, and I made the mistake that so many researchers make, and that was data driven rather than resource relationship driven. In one of the interviews that I did, if I could go back, I would change that one. But I did learn from that, and the rest were much more sensitive to the needs of the person. As a researcher, we don't go in gun ho and try and drag the information from people that we need, because they are giving it to us from their heart and their kindness. So
Yeah.
yeah, Yep.
Do you know, one thing that I would like to say, I'm going to flip that question, and that is, what wouldn't you change? And I have to say, working with, because we had another consumer liaison with us, Juliana, and the richness that came from Tammy's and Juliana's life experience was so enlightening and so wonderful. And if there were areas, sorry, let me go back for a second because I can remember having a conversation, Ashley. I'm not quite sure if you remember this. It was at the very beginning. And I said that I wanted to involve women from priority populations, and indeed Juliana came through to us through a project that Monash Partners was doing, and Tammy came to us because she was involved in developing our national consumer engagement strategy. And I said I'd like to have an emerging center and one that was mature, and I wanted to get two different women from two different priority populations, and I want to have rural and I want to have city in there, and I said because I want to do it in the most comprehensive, dare I say, challenging way you can possibly do it. And I remember Ashley saying to me, "Oh God, I wish you'd told me that before."
I almost
But
fell off my chair.
I have always said, run to the difficult. We tend to back up and try and make things easier and all those types of things. And sometimes the more difficult is the most rewarding. And, rock climbers will tell you they never go up the easy side. They always go up the hardest escarpment of a mountain because they'll learn so much more when they get to the top. And indeed, Juliana and Tammy taught us enormous things about priority populations. And, the fact that Juliana was directly connected into her community, and she was connected into the Burmese community in a small rural town in Victoria. She was connected to the Indigenous community. She was connected to the mayor. And we got interviews very quickly with her council because of those connections that she already had, bless her, out of the work that she had done. And that was charitable work that she had done in connecting with that community. And indeed, Tammy did too. Tammy had connections in Tasmania. So she leveraged those relationships and was able to get into an area whereby we may not have got into. So I have to say, I would never change that. I wouldn't change the difficulty of it because with the difficulty comes relationship. And yes, we've got to do it slower than we normally do it. And yes, it's frustrating, as Tammy has said, and I've probably been frustrated at times too. But I would say run to the difficult because it just gave us so much more. And we had those wonderful aha moments like, let's give back to consumers. Let's create something for women from priority populations, not just for the organizations that work or serve them. So I would say that. Is there any more questions?
There was a comment from the floor around thinking about co-design is about learning and running with the difficult, pivoting, reflecting, and learning and unlearning. Oh, the unlearning one's a really good one. Yeah, 100%.
That's for sure. Absolutely. And that co-designing thing, actually, you've talked about this before. The ideal is to co-design right from the very beginning.
Yeah.
We know that. We need to have our stakeholders at the table from the beginning, even when we ideate. Even before we ideate, we should be saying, should we be ideating? But
it goes back down to that shared leadership, I think, amongst everyone.
Yeah, and that's one of our principles, exactly. But I was just going to say, I remember you saying in a workshop one time that it's okay that you didn't get it right. You can still start co-design anywhere, anytime. It's not ideal, but it's still great. You can't just go, oh, shoot, we missed the boat, so we can't do this now. Yes, you can. absolutely you can. So I'm
I
really
think I
pleased
think
that,
that's the beauty about co-design is that um, it's about showing the human side of research and project work. And so even if you do make a mistake, it says a lot about you as an organization, as a researcher, to then own up and say, okay, well, we didn't think that one through. That wasn't on us. Let's start again and let's do it better. Let us know how you do it. And the more open and transparent you are with your community group, I feel like it's much better received. And we see that from brands as well when they do that. So we can learn a lot from these cross-pollination of marketing and things like that, where they are open, they acknowledge they're wrong, and they take steps to actually rectify that. I think it's, action speaks louder than words.
yeah. Tammy, did you want to say anything more to that?
I don't know if we actually did anything intentionally wrong. I don't think throughout the whole journey there was wrongness about it. I think our intention and, the overarching question that we're after was always there for us, and it led us to this journey that is research. So, overarching question, and then the windy journey to the goal at the end.
Yeah.
And, sometimes you do take some wrong turns, but you turn around
Yeah,
and go back.
absolutely. And it's such a delight to actually do a project about engaging women from priority populations with women from priority populations. That was the whole idea of the project. So I was really pleased to work with women from priority populations, Juliana and Tammy. It was indeed a privilege. I thank you for joining us on this journey. Um, I'm now going to, for some reason, there we go. So that is us wrapping up all of our CCI webinars in Wharton. And we just want to remind you that the resources are forthcoming. We're fine tuning them now. So we have resources for researchers. We have a report and recommendations for the organizations that we interviewed. We have a resource for our women from priority populations. And we also have a publication as well, soon to be submitted. So with that, I'll say you can find all of our Wharton webinars online, and that is the link that you can click on. And also, it's always helpful for us to hear what you think and what you've learnt from our webinars, and indeed how we can do them better. Just because this is our last Wharton one doesn't mean that we're not going to do any more. So please do take the evaluation, fill out the evaluation form. It only takes 2 to 3 minutes. Seriously, it's very, very quick. And I wanted to find out from Ashley and Tammy, is there any other comments that you'd like to make before we're finished today?
It's been great. It's been a wonderful opportunity, and I think it's been amazing. Thank you.
I
You're
agree. I
very
think
welcome, Tammy.
we've had some really, really good moments. We've had moments where we've sat in meetings where we just go, I don't know what's happening, and there's been frustration, but then there's been moments where, we're mucking around with filters and things and having the time of our lives. So I think it's been a really good balance, and really good resources coming out that we're very excited to share as well. So this is definitely not the end of the story. Instead, it's just the start, I would say.
I would actually like to ask Tammy just one last question before we go. And we did ask organizations a lot of questions, but one of the questions that I'd like to ask is, what would you like consumer-led organizations or support groups, what would you like them to know when working with women from priority populations? Like, what would you say to those women in those consumer organizations?
treat each other with kindness and respect, unconditional regard. Everybody has a journey, and we're along that journey at different times and levels. Just bring kindness into the work that you do and understand some good understanding of trauma, especially around priority populations, is essential for this sort of work. So, yeah, but don't be afraid to go forth because, great things come
Yeah.
from when groups of women get together, and it's really powerful, the work that we do.
Yeah, it's a really good point, Tammy, that there's diversity within diversity, isn't there? And I think we did a, a webinar on that not too long ago. What would you say to those women in an organization about working with other organizations, like engaging with councils and or primary healthcare networks, etc.?
Persistence matters. That if they don't take the first call, keep calling. Um, Eventually they'll pick up or yeah. So I guess, yeah, forge relationships and, go to places where those relationships are going to be built. If your council's having a cocktail party, then, go along and, like a lobbyist, sneak into the room and build some relationships.
Yeah. And I would add to that too, my advice for organizations in terms of building relationships is that that reciprocity exists in times when research isn't happening. Um, if there is a function that you can go to in your community, go to it. And it may have nothing to do with the research that you're doing or want to do, that you are showing up and connecting and supporting what's going on in that community. And that's a great thing. It's a terrific way to illustrate that you are genuinely interested and curious about the populations that we serve. And so, on that note, I would like to thank everybody for joining us today, and thank you so much for the comments and the questions. Tammy, it's been an absolute pleasure. Juliana, um, it's been an absolute pleasure as well. Ashley, thank you so much for your wisdom in the space because you bring both in the space. You are, a lived experience advocate as well as a researcher, and that made the process richer. So thank you for that. And thank you to Amy Armstrong for having the patience of Job with myself and the process of this project. I really, really appreciate that support. And we've had fun together. So thanks, everybody. Just don't forget, have some fun when you're doing your research. So thank you so much. And I hope that you all go well. And I hope you've learned something from this webinar today. Thank you so much. Take care.